Some states are reporting disproportionately large numbers of African-American deaths. So Steve Osinsami, he leads us off with more on this disturbing trend that even the White House is now weighing in on.
From the moment the coronavirus outbreak began, health officials have preached that COVID-19 doesn't discriminate, that it's an equal opportunity killer. But new reports strongly suggest that race still matters. Look at Louisiana. Of the more than 500 people whose final breaths were stolen by this disease, the state says that more than 2/3 of them were black.
Disturbingly, this information is going to show you that slightly more than 70% of all the deaths in Louisiana are of African Americans. And so that deserves more attention, and we're going to have to dig into that and see what we can do to slow that trend down.
In Chicago, the numbers fall the same. Most of the people who've gotten sick or died are people of color. Nearly 70% of all COVID-19 deaths in the city are African American. The city says that's nearly 6 times more fatal than what's being seen by their white neighbors.
Those numbers take your breath away. They really do. This is a call to action moment for all of us. When we talk about equity and inclusion, they're not just nice notions. They are an imperative that we must embrace as a city.
On Chicago's West Side, Reverend Marshall Hatch says it's been a tough few weeks.
Well, we had actually 4 deaths last week, and one of them was my sister who passed on Saturday, my eldest sister.
In Milwaukee County, Wisconsin, where black Americans are just 26% of the population, they're more than 70% of the deaths from the coronavirus. The reports are startling in North Carolina, Connecticut, and Michigan, too.
Based on our preliminary data, we see that it appears to be impacting minority populations greater, with 33% of cases and 40% of deaths being in African Americans.
The NAACP held a virtual news conference sounding the alarm.
These are shocking numbers. This shows the lack of inequity. This exposes the structural deficits that we've all known about. But when you put an accelerant like a coronavirus in the midst, African Americans are desperately impacted.
Policy experts tell us they've seen this before.
We saw during H1N1 that Native Americans and Latinos were much more likely to be hospitalized and even to die from the virus. And we're seeing the same thing happen now with coronavirus in places like Chicago, where Black people are roughly 30% of the city's population, but 70% of all coronavirus-related fatalities.
There are few places in America that are keeping close track of how COVID-19 is impacting communities of color, and there are some familiar explanations for what's happening. Higher rates of diabetes, high blood pressure, and other conditions that make it more difficult for someone to fight off the new disease. The sister of Reverend Hatch in Chicago was 73 years old and suffered from asthma. Rhoda Jean played the organ at her brother's church. But there's also the concern that more black and brown Americans are people like Detroit bus driver Jason Hargrove, an essential worker who posted this video seen by millions on Facebook, complaining about a sick passenger who he felt should never have walked out of her home.
I feel violated. I feel violated for the folks that was on the bus when this happened. It was about a good 8-9 people on the bus, and she stood there and coughed. That lets me know that some folks don't care.
He was a married father of 6, and he died of COVID-19 just 11 days later. There's something else that's happening. In the middle of what's becoming a nationwide economic pause, we're seeing reports of Black and Latino service providers who are taking calculated risks to keep working because the social distancing isn't paying their bills. Chicago's mayor even recorded this public service announcement saying that this isn't the time for manicures and haircuts.
Getting your roots done is not essential.
But when this photo was posted on social media showing the mayor here again standing with her hairstylist who wore gloves and a mask when she cut the mayor's hair, critics had a field day.
I'm the public face of this city. I'm on national media and I'm out in the public eye. And, you know, I'm a person who I take my personal hygiene very seriously. As I said, I felt like I needed to have a haircut.
Among American families of color, there's also a skepticism of public health authorities that dates back to the experiments that began in the 1930s in Tuskegee, Alabama, where black men who thought they were being treated for syphilis weren't. Ramel Peebles is a teacher in Brooklyn who says he doesn't trust the government with his health and at first thought COVID-19 was a hoax.
When it comes to the American government and the media, I never really trust what's being said or what's being projected. And I always feel like there is capitalistic intentions behind everything. So when I started to see that that the economy was being affected in seemingly a negative way, that's when I started to realize that, okay, maybe there is actually something going on.
There are new concerns among black men about wearing face masks in public, worried that even more people will assume that they're criminals. And this doctor at an urgent care in New York City says that when people of color do get sick, the medical facilities in black and brown neighborhoods are often unable to provide the type of care these patients need.
So we know that in black and brown communities that typically these hospitals that are called minority serving hospitals, and there have been studies that have shown this, tend to offer poor quality care. And we also know that they may not have the resources to deal with very sick COVID-19 patients. So they may not have the specialists like intensive care unit physicians. They may not have the PPE or the ventilators to really adequately care for these patients. And then just even thinking about the vulnerability of these communities before this pandemic even happened, we were in a crisis already.
Adding insult to injury, it's harder for these families to weather the economic storm of COVID-19. Experts underline that black and Latino workers are overrepresented in the restaurant and hotel industries, for example, which are nearly entirely shut down.
I'm employee at the Intercontinental Hotel in downtown Los Angeles. My wife and I, we both work at the hotel.
Orestes Rodriguez is trying not to panic. His wife was laid off 3 weeks ago, and he's down to just a few days a week of work at a Los Angeles hotel.
We're trying to comply with all the regulations that the authorities have determined. And we're staying home. We're not going out, you know. And we hope that this thing get over as soon as possible.
In Orlando, Dorothy Miracle is trying to make a little extra driving a ride share, but it's not working.
Lyft is not, going well right now. You want to?
Yes, and no, Lyft is not going very well at all. I've been home for going on my second week. I had to leave Lyft because of the coronavirus, because I didn't want to bring it into my grandkids, as well as I didn't want to be sick myself. It's real hard without the work.
Policy experts say that the racial wealth gap in this country explains both why people of color are more likely to get sick and why they have more to fear from the shutdowns. So what to do about this? It turns out that some of the suggestions help everyone. Putting a hold on evictions, for example. In Atlanta, the mayor put out this notice announcing available rent reductions at all public housing, and she's prepared to keep those reductions going into June. But health officials say that addressing the problem requires first seeing it, and there are calls for the federal government to start counting the impacts to people of color. The president is discussing this too.
And we're actively engaging on the problem of increased impacts. This is a real problem, and it's showing up very strongly in our data on the African American community. And we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible.
And Steve Osunsami joins us now from Atlanta outside the Centers for Disease Control. Steve, I think you just hit the nail on the head, right? People have to see it first and then say it first. And I think that this is really underlined with a bold marker existing health issues in African-American communities.
It is, and the president today is acknowledging some of these disparities, and his administration is now promising to help these communities as much as possible. But some of these issues are persistent issues: lower access to health care, living in places where the air and water might not be clean, living in places where it's hard to find affordable and fresh food. These are concerns that become greater in a crisis. And Lindsay, there's also the socioeconomic part of this. One thing I read today, most most of the bus drivers in the city of Chicago are black. Most of the food service workers are Latino. Those populations are struggling hard in all of this.
The black and brown community is also on the front lines as well. And the bitter irony of this is that just a few weeks ago, there were these rampant myths floating around online that black people weren't even getting coronavirus.
Yeah, that was one of the things that was out there, the idea that our melanin would make us immune to the disease, but none of that, of course, is true, as we're seeing right now.
Steve Osunsami, thank you so much for that report.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.